If you had ACL surgery, we're going to go over why 0 degrees shouldn't be your end goal after surgery. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctor. So let's jump into it, guys. So the big thing is after ACL reconstruction surgery, main goals that we want to get to is 1, getting your range of motion back. And getting your range of motion back, today we're going to talk about getting that knee straight. So the big thing is getting the knee straight is one of the big things you need to be working on early on and one of the most important things, because without that, it's going to affect the way you're walking, affecting your overall stability of the knee and arthrokinematics of the knee. So that being said, is a lot of people try to aim for 0, but we're going to go over why 0 might not be the right number to hit, especially if we're looking at your other leg. So when it comes to ACL rehab, we want to compare your range of motion to your healthy knee, the knee that wasn't injured, bearing if there wasn't any injuries. So let's say you injured your left knee and your right knee is the one that we're using for baseline, and we want to see how much degrees of either hyperextension or just how much does it get straight for your right knee. So if your right knee extends to, let's say, -5 degrees, meaning it hyperextends 5 degrees, your goal after surgery is to get as close as you can towards that 5 degrees over time. Because at 0 degrees, you have one leg at 0 degrees and the other leg at -5 degrees, there's going to be a disbalance there, especially with certain movements. So the big thing is you want to see what that other leg has, and that's what you should strive for. However, you shouldn't be striving for, let's say if your other leg has 10 degrees of hyperextension, you don't want to go too hyperextended, but you want to get as close as you can. So I'm not saying you want to go completely the same, but you want to get as close as you can to the hyperextension over time compared to the other side. However, you might not have hyperextension, so that's a little caveat that we need to talk about. If your uninjured leg only gets to 0, then 0 is your end goal. However, most of the time that we see with athletes, they all have some slight little hyperextension, even if it's 1 or 2 degrees. And that's going to be the goal that we want to get to. And when it comes to that, like I mentioned early on, let's just get to as close as we can to 0. Once we get to 0, then we're going to slowly get some more hyperextension, because if we get too much hyperextension early on, that's going to be stressing the graft early on. Because sometimes some surgeons, especially if you're very hyperextended in the other leg, they might limit some of the hyperextension of that knee with the graft site and everything. So you want to first get to 0, then slowly work your way into hyperextension. And one of the things that we see is that people will get to 0 and then just stop there. They're like, hey, my knee is fully straight, I'm good. But like I mentioned, you need to compare it to the other side. And some of the things that are going to be limiting your knee to get to your baseline with your uninjured leg are 1, muscular flexibility. So we got to look at the calf. We also got to look at the hamstring. Those are 2 muscles that, if they're restricted, are going to limit your ability to get that extra little hyperextension. Another one is the actual capsule itself, the knee joint itself. So sometimes we need to go in there and actually manipulate the knee, where we're actually providing some forces to really stretch out the knee joint capsule itself, especially the posterior capsule. If you think about the knee, here's your femur, here's your tibia. We have a capsule that surrounds around it. And sometimes that capsule gets tight after surgery. So sometimes we need to work on getting it stretched out a little bit there. Another thing that we have to really work on is getting the end range strength. So a lot of times I see people get a little bit of hyperextension, but they just don't maintain it. And that's where we really have to work on getting the quad stronger in that end range of motion, meaning like really working on that terminal knee extension where we force the quad to activate in those end ranges. And that's crucial because a lot of people will miss out on that. Another thing too is a sometimes forgotten factor is swelling. A lot of people have some consistent swelling, and that consistent swelling increases the pressure in the knee joint itself, which is then going to limit your ability to get to that true hyperextension compared to the other side. Another factor is the tibiofemoral joint and the patellofemoral joint itself. The kneecap has to move up and down, side to side. So really making sure it moves through all 4 motions, because that's going to might affect your ability to get your knee straight all the way. Also, the actual tibiofemoral joint. So the ability for the joint to glide, the knee to glide through that motion to get hyperextension. So that's going to also be affected. So sometimes that needs to be manipulated with the physical therapist. So those are the key factors, guys, and the key takeaway message is that 0 degrees shouldn't be your end goal. It should be to whatever your uninjured leg is. So if that leg is hyperextended, you want to get as close as you can hyperextended, but really don't really force it early on. Let it get to 0, then slowly get a little bit more of that hyperextension. And the big things like we went over, find out if there's muscle flexibility issues, joint issues, swelling issues, or just arthrokinematics of the knee joint itself that might be limiting that. So hopefully you guys learned about why 0 might not be your end game. And if you guys have any questions regarding your knee joint, if you want to learn more on how we can help you get your knee straighter after surgery, send us a message or comment below. We work with people online and also throughout the Southern California area. Hopefully you guys like this video, share this video, subscribe to our channel, and we are the Basketball Doctors. Let's ball for life.